25 years ago, Axios was founded with a revolutionary idea that equitable access to healthcare is possible.
We started Axios in 1997 at the peak of the HIV/AIDS pandemic. At the time, access to care and treatment varied significantly across the world. Where you lived determined what type of care you received. HIV was the first time access to healthcare gained international attention. This wasn't going to go away. HIV evolved into cancer, chronic diseases, and other conditions. If we are serious about improving access to healthcare in the long term, we had to find solutions that are mutually beneficial to all the parties involved in the patient journey.
25 years later, Axios and its partners have made it possible for more than 9.5 million patients to access quality care and treatment in more than 100 countries. Axios, transforming access to healthcare.
Hello, and thank you so much for joining us in this virtual event, Transforming Healthcare Delivery for the 21st Century. My name is Alcir Santos Neto, and I'm a senior analyst with the health practice at Economist Impact, the research and engagement platform at the Economist Group, and I have the distinct pleasure of moderating this discussion. Digital technologies have driven the discovery and development of new life-saving medicines and better tools for patient care. Yet, overburdened health systems are failing patients, and populations remain underserved. Expensive therapies are coupled with high costs, and access to care is unequally distributed. Modernizing healthcare delivery through digital technologies and new delivery models can improve access to care, enhance the quality of care, alleviate the burden on doctors and physicians, and create efficiencies to reduce costs for patients, providers, and governments. But the stakes are high. Implementation must be carefully managed, and operational systems must be safeguarded. New patient tools carry the risk of exclusion if digital literacy is not addressed in tandem. Where should stakeholders focus attention to improve healthcare delivery at scale, and what transferable lessons can be applied across countries? In the next hour, we'll explore these key challenges facing the healthcare industry, how technology can help, and how to most appropriately make that transition. I'd like to thank our event sponsor, Axios International, for making this event possible, and our speakers for their time, expertise, and contribution to the field. To that end, joining us today are Dr. Joseph Saba, CEO, Axios International, Dr. Karen DeSalvo, Chief Health Officer, Google, Dr. Mickey Tripathi, National Coordinator for Health Information Technology, U.S. Department of Health and Human Services, and Dr. Omar Abdihamid, Clinical Oncologist, Kenya Society of Hematology and Oncology. So to begin our conversation, we must understand the healthcare challenges that we see today. So Joseph, what are the trending healthcare issues you have witnessed globally, and how have these issues impacted treatment?
Well, we could see very clearly that there is a trend toward chronic diseases. Of course, we witnessed a year ago the COVID pandemic. However, for the past, I would say, 40 to 50 years, chronic diseases have been ramping up. And what this means is that people need chronic treatment sometimes for life or for a very long period. And that changes the paradigm in the way you deliver these treatments. Now, our healthcare system has been functioning as it was maybe several years ago or decades ago, looking at treating everybody, at the hospital. And what we need is to try to see how we can help the patient cope with the disease and cope with their treatment while they are taking the treatment actually at home and outside the hospital. And the digital technology is a great opportunity for us to be able to do that at a lower cost than what we are experiencing today.
That's an excellent point you brought up, Joseph. And I wanted to ask you, Omar, with your work in Kenya, are you experiencing the same healthcare issues and challenges?
Yeah, thank you, Alcia, for your question. It's the digital health space scarcity or its availability, for that matter, is a really present time issue. Now more than ever, we know COVID has really taught us what digital health can really do to the healthcare and the delivery of healthcare services. So to answer your question, yes, indeed, we are really in a time where we are shifting from um, quote unquote physical sort of delivery of healthcare to digital. But in Kenya, particularly, we are not yet there, but we are in the right direction. There's a lot of acceptance and availability of digital healthcare platforms. There's so to speak, ubiquitous use of healthcare and technology, be it online telemedicine, virtual CMEs, continuous medical education, which is on a weekly basis, teleconferencing, and a lot of similar technological advances in the healthcare system. But for Kenya specifically, due to some really local factors and uptake issues, we are not fully yet there, but signs are there.
No, that's a great point. And I wanted, considering these issues, Karen, I know we have seen health becoming increasingly consumer driven and mobile first in the age of healthcare modernization. So from your perspective, what challenges and opportunities do digital tools and these new technologies pose in improving personalized healthcare delivery?
A lot of what we've already been describing is this need to be able to meet people where they are and not expect that they're going to come to a brick and mortar facility, to change the tools in the hands of the workforce so that those tools are also more mobile, and also to put more knowledge and insights into the hands of consumers. And though it's not ubiquitous, about half of the people in the world have a smartphone in their hand, and so it's an incredible opportunity to think about that as a tool, not only for consumers but also for caregivers on the front lines, and convert that not only into uses that we have for our everyday lives in other ways, but also to help people with their health. So, examples would be ways that we and other companies are looking at how smartphones can become a stethoscope in your hand, or take vital signs, or enhance maternal ultrasound. There's also the opportunity for the phone to be health in your hand, to do things like help healthcare workers on the front lines do documentation or access best evidence-based guidelines, or some open source work that we're doing with the World Health Organization, something called Open Health Stack, that helps to bring evidence-based guidelines right to the hands of the community health volunteer as they're seeing the person, again, meeting them where they are, but also having data and knowledge meet the healthcare worker where they are and making it as easy as possible. So I think that directionally, not only for consumers, which we want to continue to give them the knowledge and insights to have that agency to drive their own health. We also want to help frontline workers so that they can have the knowledge and the tools right there in their hand. And I think that world is getting closer. That future is getting closer in many ways because of AI, and because of the opportunities of starting to think, as Omar said, about the capabilities, not just in some parts of the world, but being able to bring those tools to everyone everywhere in a way that makes it more ubiquitous.
Now, that's an excellent observation, and some of the tools and some of these opportunities that you mentioned, Karen, we're seeing in the U.S. And I'm curious to ask you, Mickey, what are some of these challenges and opportunities that you see in the United States for these digital tools and these new delivery models for technology?
Sorry. Yes, I think it's both. We've got both the challenges and the opportunities in the U.S. On the opportunity side, we've got a tremendous amount of momentum, that's been building over now over 10 years with large investments that the federal government has made through incentive programs to get very, very broad and relatively deep adoption of electronic health records across the healthcare delivery system, from hospitals and ambulatory practices in particular. And then actually when Karen was in my job, a number of years ago, she spearheaded, sort of the next policy push, which is the availability of information through more modern internet conventions like APIs, so that you can access that through smartphones and using the, sort of the interoperability approaches that the rest of the economy uses, basically bringing the internet to healthcare in the U.S. finally. So I think those are really important, sort of policy pushes and large-scale investments that we've made in the U.S. to create that ecosystem. So that's the opportunity, and a lot of that work has been done now. And now we have the opportunity to say, what is it we want to do with this? And what are the opportunities that we can build on top of it to actually change the way that we think about healthcare, both from a patient perspective as well as from a provider perspective? And therein lies the challenge. So the opportunity is that we've made some large-scale investments. We've got a lot of policy that helps us, put all of that in place. The challenge is that we've got a highly fragmented healthcare system in the U.S., unlike other healthcare systems among our industrialized peers, which tend to be, many of them tend to be, much more centralized in certain ways, whether it's on the payer side or the provider side or both. In the U.S., it's highly fragmented across payers, providers, jurisdictions across our 56 states and territories. And so that's where the challenge lies in the U.S. is, how do you get the kind of policy momentum across these jurisdictions so that organizations can actually take advantage of these tools that we have in place now from a business and a care perspective to be able to get us to the next level of care and allow us to embrace what sort of the full digital experience can bring to healthcare.
That's an excellent point. And just as you mentioned, from a business and care perspective, efficiency is also something that we need to consider from these tools. And as healthcare continues to modernize, we know that technology also promises to improve efficiency. And Mickey, I was wondering, and I would like to transition to our discussion to ask you, how is the healthcare industry using these new efficient tools to reduce costs? And what have you seen across the board?
Yeah, so it's a slow transition, I would say, but I think that we're starting to see the next horizon here, as we say, because as we all know with technology, it's a lot of hard work to get technology in place. And I think there is an adage in the technology industry that we always overestimate the benefits of technology investment over 5 years, and we underestimate the impact over 10 years. And as I said, in the U.S. now, we're in our second decile now. Invested about 10, took about the first 10 years to invest in electronic health records and in and more modern API-based interoperability. So now I think we're starting to see that next horizon, starting to see, what are the benefits, the longer-term benefits that we might be able to take advantage of here. And I would just point to a couple. One is the great, sort of almost ubiquity in the U.S. of a patient's ability to have direct access to their medical record information through a mobile phone, for those who have a mobile phone, or through a patient portal. And certainly the pandemic accelerated that as we were, forced to be in situations where we had to have location-independent interactions with our care delivery system. And so that's sort of the first opportunity when you think about the ability for interactions among patients and providers using more remote kinds of tools. Telehealth just being one example of that, but being able to get more immediate access to your results, for example, being able to message your providers, for example, which was not really very common in the U.S. before, but is much more common now. And I think that's provided a lot of benefits if you just think about the time and convenience on the patient side that doesn't always get monetized, but it's an important part of what we're trying to do here at the end of the day, which is make it easier for patients to be able to access the healthcare delivery system in a way that that serves them best, as Karen said, to meet them where they are. The second thing I would point to is with the advent of these of more broad use of more modern API kinds of approaches, and without getting into the technical mumbo jumbo of an API, what that enables is the kind of interactivity and the potential for automation in healthcare, which has been sorely lacking in the U.S. So the kinds of interoperability approaches that we've had up until now have been very much about I send you data, you send me data. But as you think about the way that an app works on your mobile phone, for example, if you're making a purchasing decision or ordering a meal. That's a very interactive experience. And that's what we're starting to see the potential for in healthcare. So, for example, in the U.S., because of the payment structure, prior authorization, meaning getting sort of permission, as it were, from a health insurer for the care that you are about to provide, in many cases can be a very bad experience for the provider, who has to spend a lot of time getting that kind of approval from the health insurer, for the health insurer, who has to take the time to figure out for this particular patient or this particular treatment or this particular episode whether that patient has that health insurance in their coverage, and for the patient, most important, for them to actually have to wait and figure out whether they're going to be able to get the approval for payment for for their next episode of care. Let's say the specialist care that they desperately want to be able to get. So that's a very bad experience all around in the U.S. And now we're starting to see the opportunity, using more modern internet-based approaches, to be able to say, how do we automate that interaction between the provider and the payer, so that we're not having to have these lags of days and sometimes weeks, literally, to be able to get that kind of approval from the insurer. And importantly, the patient's ability to be able to view and track that as it moves through the system, which is an important benefit for a patient to understand. Right now, it's a black hole where they just find out that we don't have authorization yet. We'll let you know when we get authorization. You can imagine a patient who might be in a sort of a desperate situation in terms of wanting to know what the next diagnosis is going to be, for example, feeling fairly traumatized by having to wait for an inordinately long period of time. The ability for them to just be able to track it in the same way that I can track a package on Amazon, or the same way I can track my Uber or my Lyft ride as it's coming, even though it may take maybe it's a little bit faster than it used to be, but my ability to just see it and track it, I think, is a huge benefit that we're starting to see. So that automation and the ability for patients to be more directly involved in seeing what's going on and having more of that transparency, I think, is going to be a huge benefit that will pay off over the next number of years.
No, that's excellent. Thank you so much for sharing that. And I think you bring it up a really good point. You previously mentioned that fragmentation is also a problem, right? And we know that systems are not entirely efficient, as you pointed out. So, Joseph, I really wanted to ask you, how do you balance this increase in access to care with an already overburdened healthcare system, which we've been seeing in so many systems around the world?
Yes, actually, that need for digital transformation and also the need of modernization of the healthcare, it came through my experience to access to care, but also specifically access to treatment. Treatment, in the end, is the center of what you can deliver to patients to help them. I mean, without treatment, you can diagnose them, but it's helpless. And for access to medicine, more specifically, with the event of chronic diseases, and it started early in the career with HIV, where antiretroviral transformed actually HIV from a deadly disease to a chronic disease. And then you had all these treatments related to chronic disease. What was important is to know what happens to the patient when they get the prescription and they leave the hospital. We don't really know. And even during the COVID pandemic, when these people with chronic diseases were the vulnerable population for COVID infections, we didn't know where they were. We didn't know how to reach them. Connecting the patient is really what matters from what I found, and connecting the patients to the hospital, to the physician, to the pharmacist, to the radiologist, and to us following them, because now we run programs on access to medicines. And that really helped us a lot in the COVID pandemic. We could reach out patients, make sure they get their treatment, make sure that they are protected. And this connectivity only could happen through digitalization of healthcare. And that's really how it worked. It was interesting because, I actually ended up writing a book about that related, it's called World Undivided, because I could see the fragmented response. And Mickey was talking about fragmented healthcare. You're right, Mickey, but not only in the US, unfortunately. I mean, when we look at the response to the COVID pandemic, it was disastrous. you had as many policies as you had not countries, but sometimes regions in the countries related to that, and it's the same disease. And now we have chronic diseases that are becoming similar all over the world. We have treatments that are similar all over the world, and yet we have all these fragmented healthcare and fragmented policies. So I think this connectivity of patients and walking that extra mile with the patient has been proven very helpful from my experience.
That's an excellent point. And these access challenges, as you mentioned, is critical. And Karen, I wanted to ask, because with these access challenges, patients still need access care. So how can technology efficiently empower and reshape how patients interact with their health? And how has your work led to that?
So many great points made. I want to maybe start with this notion of fragmentation, because the world that we're moving into is one where there's less and less fragmentation of health information technology policy and approach. And that's incredibly helpful as we're working to also have digital drive equity and improve access to the best quality care for everybody on the planet. And that world will get easier as standards like FHIR, which is an open standard that is used by most countries around the world now, make for this more internet-like experience that Mickey's describing, but very importantly, make it easier for organizations, whether it's governments or NGOs, to build applications for documentation for providers or for information for patients or for the connections that you're hearing about. So it's the technology system itself is becoming less fragmented, actually. And so that's, I think, a really helpful signal into the future. And the more open standards we have, the easier it is to do that in a way that no matter where people are in, especially if they're crossing geographic boundaries, their data can go with them, with their consent. The second thing that is exciting to me about this opportunity that we're in this next chapter of global health is generative AI and other AI tools, especially when it comes to addressing access to care. The way we think about AI as a tool in the toolbox for care providers and for patients is that it can fill gaps, particularly workforce gaps. There are people in the world who don't have access to care. There are also, parts of the world where there may not be sufficient numbers of radiologists, dermatologists, and finding ways that AI can augment the practice and help extend those existing providers is a really important way that we hope others, and we certainly do, will think about using AI as an added part of the team, the medical team. So, for example, we already work with organizations around the world to use artificial intelligence to read chest X-rays to look for multi-drug resistant tuberculosis in sub-Saharan Africa. So this is not meant to replace the clinicians, but with a human in the loop, sort of add additional capabilities so that the abnormal films float to the top of the list, and that's what the human readers will see first. Similar notions around looking for diabetic retinopathy. This work we do in Thailand and India, and use that as a way to identify the highest risk individuals so that they're the ones that get the highest priority referrals to the ophthalmologist. So I see that the world is moving in this direction of using AI as an augmentation to workflow to improve access to the highest risk cases and match that supply and demand. I also think for consumers and for patients, this is going to help them know how to self-navigate. So over time, they're going to have a much more personalized, a more anticipatory experience, one where care is more convenient for them. And I mean that word in a really positive frame, a way that that technology in their hands will allow them to connect via telehealth, via chat. Over time, I suspect that healthcare systems are going to start to create more and more information bots to help people navigate when they're outside of the physician's office or the hospital, or not in the room with the community health volunteer, but rather, what are all the things that happen in between, and how can they have those helpful nudges and reminders as a part of their everyday life. You see the uptake of those kinds of tools to be very strong when people have access to having sort of their own agent or coach helping them along in their daily journey. The more information people have, the healthier they are. We firmly believe that information is a strong determinant of health. So thinking about how also tools like AI enable people to have their own information, get insights from it, and self-manage in those in-between times when they're with healthcare. So I'm actually quite optimistic about how technology and tools, including the ones we already have, like phones and some of the underlying components, like some of the open standards that internationally are being adopted, but very specifically how those are translating into tools and technology that are improving the capacity for where there are workforce shortages, or making it easier for workforce to do their highest, most important work first, but also to put those tools right in the hands of consumers so that they're self-driving as much as they possibly can.
Yes, these tools such as AI really is promising and exciting. And I wanted to just circle back because you talked about also policy fragmentation. I think that's very critical. And I wanted to go over to you, Omar, because I wanted to move our conversation towards the topic of governance. And I know you have international experience working and researching in Kenya, China, Canada, among so many other countries. So from your experience, how can the international community collaborate so that way we can build a framework despite differing healthcare laws at home?
Yeah, thank you, Wiki. A lot of great pulse coming from the colleagues, and I'm thinking of also bringing the loop into the other part of the world of the digital divide, as Dr. Karen has mentioned. And I like one point that I want to piggyback on from Dr. Karen, that she mentioned the digital equity. I love that term. In cancer world, we talk about cancer care equity most of the time, and the gap really widens between the global north and the global south, or the so-called high or low and middle income countries. So governance is a big thing in Kenya in terms of digital health regulatory issues. But when I think of it, the biggest problem we have right now in Kenya, especially at the community cancer services, I'm a community oncologist, and I run a community cancer center in northern part of Kenya, which is a highly marginalized area. Is that there's really nothing much of an obstacle, to be honest, in terms of digital access, and in terms of even existing regulatory laws of Kenya in terms of digital access. When it comes to healthcare, they are more relaxed. They're not that. It's not content, control. It's more of a health access control. So the governance part in Kenya, it's a very young economy. 75% of the population are youths. They're all tech savvy. There's a huge data circulation and a huge uptake of mobile services. And even we did some work sometimes back on cancer care services through mobile app in the community cancer centers, where patients can report what we call patient-reported outcomes through the NSMS if their white blood cell low count go down because of the chemo they got the week before. So in terms of governance, really there's really not much of an obstacle. You could say, is that a good or a bad thing? Or maybe you could even say the realization of regulating the digital healthcare space might be something which is a ticking time bomb for a good thing or a bad thing. But if you ask me as a caregiver, really digital health services or digital access, especially in the cancer care landscape, is really something which is very important. But I also wanted to take this opportunity to also share the digital services that are lacking or available in Kenya. Maybe in 2 minutes. Most of the Dr. Miki talked about electronic medical records. It's sad to report that some part of Kenya, actually in public hospitals, we still use patient charts, physical patient files, which can really, you cannot save. People are talking about saving the data in the cloud and AI and moonshot by Dr. Biden, by President Biden in the cancer care space. And in the global south, people are really struggling with the data preservation, something Dr. Karen might really pick up on digital, on creating maybe open access with collaboration through Axios and Google in, creating cancer registries, for example. We do not have most of the centers do not have digital based softwares, where softwares like DHIS, which is Digital Health Information System, where you just go to a tab and you filter and then you get the data from which year to which year. So that is one of the problems that we have in the country. And also, Dr. Mika, he mentioned, a click of a button, the patient can really access their health records, and it's becoming a right these days for patients to access their healthcare medical record. That is a far cry from what we have. Patients usually do not have an integrated national or a regional database where a doctor might have seen a patient in certain county or in the periphery part of the country, and when they come to the capital city for second opinion, they just have to go back to the whole process again. MDTs, multidisciplinary tumor boards, where we discuss cases. Usually that's a very good uptake in Kenya in terms of virtual space. Telemedicine, usually in the teleradiology, where a scan can be reported by a doctor in the capital city, a CT scan for, let's say, a cancer case, which we need to know the stage of the disease. Sometimes we do not have the MRI, for example, in that community cancer center, but the patient, or we do have, but we do not have a radiologist who can report it on time. So what happens is they do the MRI there, and then through digital, reporting, a radiologist in the capital can give a report. And then there's the digital pathology. We in the cancer world, we talk about diagnosing cancer using tissue. We like to joke. Cancer is not a joke, but we like saying tissue. Cancer is, like tumor is rumor, tissue is the issue. If you do not have a tissue diagnosis, no one can tell you have a cancer for sure. So what happens is like the digital pathology is actually picking up in Kenya as well. And then there's a tele-prescription. A patient can really have a low, a severe event to their chemo they got the week before, and the doctor can just, through an interface, prescribe, drug. I know that has different regulation in different countries, but really, if it's the patient and it's being prescribed by the same doctor, it can save the patient at the hour of need. And then there's the patient education apps. We do a lot of layman translation of complex medical or cancer terminologies to patients, and education and empowerment using again digital and health space. So really, there's so many things like you can really leverage on the digital space, especially in sub-Saharan Africa, where there are huge unmet need and a young and very vibrant and very receptive, which are tech-savvy population.
Thanks, Omar. I think it's very interesting that you pointed out this clear contrast between the global south and, as you called it, in the global north.
Can I jump in for just a second to respond to Dr. Omar? Because we have a work that we're doing in Kenya, and I think it highlights some of the things that he's talking about. And so one of them, for example, in the space of clinical documentation, in the U.S. We implemented electronic health records that were built very much through the lens of what the U.S. healthcare system needs. They're not always as agile for other use cases in other parts of the world. And I think one of the exciting things that I'm seeing happen globally is that use cases that are more targeted for, say, a community health volunteer going to community can be built better, smarter, faster, cheaper, to allow for some of that record keeping. And an example for us, we're working with a group called Intellisoft in Kenya. They're using our Open Health Stack technology. This is an open source that is as a toolkit that they've been able to use to build an app called Mama's Hub that allows community health volunteers to, rather than carrying around big paper logbooks, which is what they were doing, to be able to document on their smartphone. And so it's a way of having a digital record for the caregiver that doesn't require the implementation of an entire electronic health record. So a good step forward. I'm going to give another example from Kenya of how we're using AI in partnership with Jacaranda Health, which is a maternal health organization also. And an example where you don't need to have big digital stores of data in the cloud, but rather using AI technology to improve language access. So one of the ways that we're working with them is to they have a patient-facing educational set of tools, and to add additional languages for them. I think 4 is what they're planning to add, and AI translation capabilities are helping to accelerate that and make it easier. So just for all of us to remember that sometimes we don't have to replicate what I might call some of the heavier ways that we've used technology in the past, and can learn a lot from what organizations and frankly innovative IT leaders are doing in places like Kenya, to think about what are the needs of frontline workers of patients that can be solved with technology in a way that solves for those use cases and doesn't necessarily import use cases from other geographies.
No, thank you for sharing that. And in that,
I would just add, just building on what Karen and Omar said, I think it's such a great point that that the electronic health records that we invested in the U.S. are very much based on the U.S. healthcare system, the medical legal sort of record that's required in the U.S., the payment system that's required in the U.S., and the fact that a large number of provider organizations in the U.S. are large enterprises and have the capability and the need for an enterprise-like system. But even in the U.S., as we look at parts of the healthcare continuum that didn't get those incentives from the federal government, like behavioral health, for example, we're starting to take exactly the same approach and thinking about that as Karen and Omar are describing, which is there are much more lightweight approaches that actually are very tailored, using more modern internet conventions, and are tailored to their specific needs. That might be much more appropriate for the digital needs that they have, that doesn't require sort of a full-blown heavy iron kind of electronic health record system. So I think it's a fantastic point, and one that we're looking at as well. We're also, I think, in looking at the work in Africa and in other and in Asia, for example, where you have the need to develop technologies that can work in areas of low infrastructure, and that can be human capital infrastructure as well as technology infrastructure like internet, and lack of availability of broadband, for example. There are many parts of the U.S. that actually have similar characteristics, and so I think there are a lot of lessons learned from work that's being done, I think, in Kenya and in other places, for example, with remote diagnostics, things like that, things that Karen was describing, that actually will have great utility in the U.S.
Yes, and just to elaborate also on that, and that has been also our experience in working in low and middle income countries related to access to care. When you're bringing all these innovative technologies and trying to modernize, often it's easier to do it when you have lower infrastructure. I mean, if you go and try to do it in Europe, for example, it's so heavily regulated that it's extremely difficult to undo so many things and to redo it. So I think, Omar, the fact that maybe there is an insufficient infrastructure, maybe the opportunity for us to get it right with the digital technology, actually.
Yeah, I agree with you, Dr. Saba and Dr. Miki and Dr. Karen. Necessity is the mother of invention. I mean, that's not to say the regulatory bodies are not very relaxed about it, but I think they're a bit lenient on the healthcare service delivery. I mean, it's anyone will be a bit lenient. Anything that will, any innovation that is brought to change the life of any, suffering, to alleviate pain and suffering. But I think what I have been seeing from the digital space, and even maybe Dr. Karen has mentioned the ongoing collaborations and the projects, there's less uptake in these collaborative projects in the non-communicable space diseases, NCDs, so to speak, compared to the other maternal and child health, reproductive, and maybe it's because of the awareness and even people not actually appreciating the need for digitalized cancer care services. It's a very expensive diagnosis. Digital services really makes it much cheaper, and even that reduces the gap, the digital divide gap, in the cancer care world space, especially in the low and middle income country vis-a-vis global, high income country.
Yeah, and it's a difficult treatment in patients that have hard time coping with their disease. I mean, it's absolutely.
No, it's really exciting to see some of the challenges and opportunities that all of you have been talking about. And I just want to transition to talk a little bit about the future, because we see so many promising tools, so many opportunities, collaboration happening at an international stage. So I'd like to start with you, Mickey. What do you see the future in the United States for this transformation of healthcare delivery and utilization of technology, let's say in the next 10 to 15 years?
Yeah, I mean, 10 to 15 years is a long time in the digital world, but I will say, what we're trying to do here is lay the foundation for an open architecture type of ecosystem, health IT ecosystem based on open industry standards, as Karen was describing, to be able to allow innovation to be able to build on top of that, so that core infrastructure, that baseline capability to be able to get baseline information regardless of where you are in the U.S. and regardless of who you are, as long as you're authorized. So whether you're an insurer or a public health agency or a patient or a provider, your ability to get access to information as authorized securely at a sort of a baseline level is not the barrier to your being able to innovate on top of that. So that's really what we're aiming for here, and doing a lot of work to kind of roll up our sleeves and allow that ecosystem to sort of build and flourish. From my perspective, I think as we look out over 5, 10, 15 years, what we want to be able to see is the opportunities for a much more 360-degree engagement for patients and providers and other authorized users of healthcare information to be able to have access to that information and develop a wide variety of tools that allow patients in particular to be able to engage across their entire lifetime and across their entire healthcare journey in ways that they're not able to in the U.S. right now. In the U.S., we tend to think of healthcare as being when you get sick and when you either go to the doctor or you enter enter a hospital. But I think as we take a more expansive view, and certainly in other parts of the world, they have taken a more expansive view in terms of social investments in health, where we haven't done as much of that in the U.S. I think the opportunity to be able to say we can use digital technologies to allow patients to be able to more directly access that social investment side of health, to be able to sort of embrace their sort of lifetime journey between wellness and health and wellness and sickness and wellness and sickness, to hopefully reduce those episodes of sickness with the better access to information and better access to tools that are more tailored to their individual circumstance.
Now, having this public perspective that Mickey just shared with us, Karen, I wanted to contrast that with the private sector perspective. What do you think the future will look like the next 10 to 15 years?
Well, I don't think there's much contrast, because I do agree with very much of what Mickey said, especially thinking more holistically about health. You can imagine that what's very top of mind for us in technology, the technology world, is large language models or generative AI, this new generation of AI capabilities that are demonstrating an opportunity to create a future where everyone on the planet has access to the best quality care for communicable and non-communicable disease, Omar, in their hand, because they have not only can access services through video or chat or ambient sensing that's helping them with personalized insights about their own health, and that with their desire, they can keep their health information on their phone, so that their personal health record can be it can inform what a personalized agent will be able to do for them. I think we're seeing a world in which consumers, patients will have everyone will have a personalized experience with care that's more anticipatory, and that'll be largely because we'll have an agent working in the background on our behalf all the time, understanding our data and our preferences, and being able to link us to best quality information and care. And look, all that has to happen with consent. All that requires that the trajectory of access to technology happens in a way that doesn't exacerbate the digital divide, but actually eliminates the digital divide, and that we're building with intention, with equity in mind. On the other hand, I think it seems highly probable that if the direction of AI continues to be making it more affordable, accessible, and bringing care to meet people where they are, and making care the best quality possible in the moment, and the most personalized for the person. I think that's a very realistic expectation, literally for everyone on the planet. So I'm incredibly optimistic, and I don't think that's just about healthcare. Just to end on that point, I think this is an opportunity for this to really reflect personal cultural preferences, but also to weave together not only your physical health, but also emotional health and social health and well-being. So very optimistic. And I don't think the whole world's solved with AI. I think there's a lot. If we want to be bold about it, we also need to be responsible. On the other hand, we're pretty excited about the capabilities we're seeing and some of the innovation that is happening in every region of the world, whether that's in Asia Pacific or in Africa or in Latin America or in Europe or the US. I think there's a lot of really bold thinking happening on the part of healthcare and of government, and also of innovators to try to solve some of the important health challenges that the world is facing. And so we're very excited to think about everybody, about democratizing access to health, I think is the way that I would describe it most succinctly.
And I wanted to give you a chance as well, Joseph, with your international work in so many different countries. Where do you see the future?
Well, I mean, I tend to agree with Ken and Mickey about the fact that we are heading to a digital transformation, and there are certainly tools, and these tools are getting better and better to be able to manage healthcare in a better way. I may be a little bit less optimistic about the time it will take, not because of technology, but because of healthcare policy. You know, healthcare policy has been conservative for a very long time, and we are the last actually sector not to digitalize. Or to be lagging behind in digitalization. You know, finance, banking, trading, all of these have digitalized, and we're still lagging behind. And the reason for that is, if we can summarize it, is really related to the way we view the healthcare sector, very focused on hospital, very localized, community localized. While it is needed, but as I was saying, you know, it is time also to globalize healthcare, knowing that you still need that community component. But that is a mentality issue that we need to work on. And in my opinion, this may be the obstacle we need to work on to open it up. But once we overcome that obstacle, then I think we will have a lot. So I am optimistic. I think we still have work to do.
That's exciting.
Because I think, one of the things I think we've seen in technology in general is that, process and policy change always lags technology change. And it also isn't uniform. So if we, unbundle this a little bit and you think about the opportunities that technology offers and digital infrastructure offers for diagnostics, for example, our ability to actually have remote diagnostics, to be able to, get AI-based or AI, augmented expert opinions based on imaging and other kinds of diagnostics out in the field, that can be fantastic. And you can see the obvious growth that's already happening there, whether it's in rural Kenya or rural Alabama, right? Those opportunities are there. But on the other side, how do you actually take the next step and say, well, we need to have access to treatment for those people? It's, you've only solved one part of the problem by saying I've diagnosed it. And for some types of interventions, like medications, for example, like vaccines, for example, there are ways of being able to figure out how to hotspot and target those kinds of interventions. But for others, where it actually may need a highly skilled oncologist like Omar, or an interventional radiologist, if we don't have access to that kind of treatment, we haven't really solved the problem of healthcare. We've only sort of pointed out where we have healthcare issues in a better and more efficient way.
Yes, absolutely. And when it comes to access to treatment and access to skilled oncologists, technology is going to be very important. And one aspect that we see is adherence to treatment. We didn't talk about it yet, but for chronic diseases, this is paramount to get good medical benefit, because it's not only a point of having the medication in the country or just doing a prescription. And here, also following the patient and the digital technology can help greatly in improving adherence to treatment and maximizing medical outcome, which in itself actually is going to lower the cost on healthcare.
For the remaining time we have left, I would like to turn to some questions from the audience, because our audience is very excited for this. So Omar, I wanted to start with you. From the patient perspective, what do you think can be done to improve digital literacy?
Yeah, I think that's the easiest part. I think by building up apps that are culturally sensitive, linguistically sensitive, which really can match with the local and the cultural perspective needs of those patients. Because remember, diseases really are driven by culture in terms of its compliance, in terms of the perception of even the cancer itself. The people who believe that they can be cured by supernatural beings. There are people who believe in some parts in Africa that I am aware of that they can just just apply some herbs and then they're good to go. So the cultural sensitivity part and the linguistic part, by building probably apps that can really link that as a need for compliance and the improvement of his service is the way to go, I think.
Karen, this is a very interesting question that I personally am curious to know your answer. Someone from the audience asked, how do you view the use of apps in our daily routine to make health improvements in our habits? Do you think that the population will tend to actively use it, or do you think it will be forgotten?
One of the reasons that I came to Google was because we're actually a life company. We're not a healthcare company. So we are, in many parts of the world, part of people's lives when they're seeking information about the sports scores or directions or how to cook something. So what that means to me, especially thinking about my patients when I was practicing medicine, is I'm not in their life all the time. I'm a special place that they go for their diabetes checkup or if they're not feeling well. And I always, wondered and worried about how to help them in those everyday moments that really matter to them. So apps sometimes can fall into that category. If you're pregnant or if you have cardiovascular disease, you're going to be paying a lot of attention to your health, and the app will make a big difference in you tracking and understanding and being connected to your provider or to other resources. For many people, though, they don't have a reason to check an app every day. And so we often think about, as a company, how are the other ways that we can help amplify health information, especially from public health agencies or from other credible authorities. So when people are looking something up in the search bar, that we can lift up the highest quality information from an organization that folks trust and address harmful misinformation on the other end. I think we also have been learning more and more about the opportunity that we have, again, outside of apps, which have a role, but to think about messengers on platforms like YouTube. Omar mentioned youth, and around the world, this is sometimes the first place that youth go is to some video source to look for information, YouTube being one of them. And that's an opportunity to provide not only the information, but have a messenger that's already trusted. And sometimes that messenger is a musician or a sports figure and not a clinician. And so how can we as a company partner with organizations like the World Health Organization or local ministries to help get the best information to those trusted messengers who are a part of people's lives in other ways that aren't for health, and think of that as a way to have added community that provides that information and insight for people. So I think there's a role for all of these, and I really don't think there's only one pathway, but I do think that we for us at Google, we think about how we have an opportunity and when we're in people's lives and they're looking for information that's maybe not in an app to help direct them to the best quality information or give them a messenger that they're going to trust.
Thank you, Karen. Mickey, someone asked, what are the crucial and fundamental elements that hospital IT systems needs to be considered built to scale up in tandem with the growth in digital healthcare delivery?
Oh, yeah, sure. So, in the U.S., we have, sort of a nationwide sort of policy and regulatory approach that sort of helps define what those core capabilities are or should be across the country for those, and very specific to the U.S., for organizations that are participating in certain federal government insurance programs. And that's the lever that we use in the U.S. to drive across those jurisdictions. So in particular, Medicare and Medicaid, we basically, through a set of policies that we kind of orchestrate across different agencies between my agency and Medicare and Medicaid, we basically say the providers who are participating in those programs, meaning providing services to patients who are getting government health insurance, are required to have electronic health record systems that are certified by my office and that have certain key capabilities. And certainly basic documentation capabilities are a part of it. The support of open data standards is another part of it. And key interoperability mechanisms based on open industry standards are a key part of it as well. And a part of that open interoperability, I think open interoperability approach is, we have a lot of focus on that patient access piece of it, to be able to say that, patients need to be included in that interoperability equation. So it's not just about providers with health insurers, providers with other providers, providers with public health, but also all of those entities with the patient themselves. I think it does begs the question a little bit of the question that you asked, Karen, which is, how much do patients care about that, actually? And, from our perspective, that's kind of an open question right now. We don't know the answer to that. I think Karen pointed to a number of ways that we've seen in other parts of the economy where patients do directly engage, and there are certainly ways that I think we can think about from a private and a public perspective to get greater engagement for patients. From our perspective, from a policy perspective, we just want to make sure that patients have the ability to access the information so that an innovation economy can hopefully develop around that to support patients' personal preferences and the kinds of things that they want to be able to do. But it is an open question of what fraction of patients want to have that kind of direct engagement in their healthcare through that entire journey. The point is, from our perspective, that they ought to be able to have that choice.
That's an excellent point. We also have a very interesting question here for you, Joseph. What is the public healthcare system of the future?
Well, when we look at the public health care system as it is now, as I mentioned, it's very focused on local policy and local community. And if we are to embrace that digital transformation, then we need to be able to globalize it. Not all of it, because you still need the physician next to you. You need to go to the pharmacist. You still need, localized healthcare. But certainly, the way I see it is that to embrace that technology, we need also to change the way we do things, the way we handle the patients, the way we make the policies, and I think this is what probably is likely to take the most time, is to be able to change these policies and to change that behavior, to have a much more connected healthcare system, and where part of it is globalized and part of it remains local by definition. I mean, that's the way, at least I see it, and that's going to help us in many aspects that maybe we didn't discuss today, which is preventive medicine, vaccinations, pandemics, how to deal with the pandemics, and many other aspects.
Well, thank you for answering that. So unfortunately, we're out of time, but today's discussion really has been fascinating. So far today, we discussed the key challenges facing the healthcare industry and transforming healthcare delivery, how technology can help, and how to most appropriately make that transition. So I wanted to thank you very much to our panelists, you, Joseph, Karen, Mickey, Omar, and to all of you for tuning in. And thanks again to Axios International for making this event possible. And to view this and other similar events, please visit economistimpact.com. Thank you so much and take care.